My name is Lauren, and I'm using the medical ketogenic diet as a form of treatment for my schizoaffective disorder bipolar type. I've been doing this since the end of December, and I have been sharing about it publicly on this channel and kind of documenting the process and how it's been going for me. And a quick recap overall, it's been going better than I could have ever thought, really. I am experiencing far less symptoms, actually almost no symptoms. And just my experience of my illness has changed so dramatically. I feel so much more capacity and I think that's the best descriptor I can think of is just feeling a really big increase in capacity. And so when I started this project, I was taking my regular dose of antipsychotic medication. And I've remained on antipsychotic medication throughout this process. But in this video, I want to give you kind of a recap of what has gone on with my psychiatric medication over the last 3 months of this keto project and where it's going now in the next few months too. Now, I've made it kind of a thing over the last 5 years of sharing publicly on this channel, never to disclose exactly what medication I'm taking. And there's some very important reasons why I've chosen to do this. And the primary reason being that psychiatric medications work very, very differently for each individual, and something that works really well for me may not work at all for someone else or may give them intense side effects, or likewise, something that doesn't work for me, gives me a lot of side effects, may be the best drug possible for someone else. And that's kind of why I never shared exactly what my medication regimen was or exactly what I was taking, for fear that other people would see me doing well on it and decide to take it themselves without consulting with their doctor, which is something that you really need to do when figuring out which medication is the right one for you. But, sharing publicly this kind of single person experiment I'm kind of conducting out in the open for you all, I guess it does kind of make sense to give a little bit more information about what exactly I've been taking and what the tapering methods have looked like throughout this process. So I have been on lorazepam, brand name is Latuda, but I take the generic form of it, so lorazepam, for several years now. And I've been on it before too, and it's always been the one that has really been the best fit for me. I've tried other antipsychotic medications that either have had more side effects or didn't work as well to manage my symptoms, and this is kind of the one that I found has worked best for me. And so when we started this project, I was on a dose of lorazepam of 100 milligrams, but I've been as high on lorazepam as 140 milligrams throughout the course of treating my illness. But again, when I started, I was on 100 milligrams. And if you've been watching this project and following along, you may already know that I experienced fairly early on in this project something called potentiation. I think it was about 3 weeks into using the ketogenic diet, I experienced this thing called potentiation, which essentially is where your body starts working differently or working better is really what happened. And all of a sudden, the medication that I was on was too much for what my body and my brain needed. And I began to experience over-medication and experience more side effects of it. And this showed up primarily in the form of experiencing much more sedation, especially in the mornings, because I take my medication at night. So it's still kind of a higher dose moving through my body in the mornings. And so I consulted with my keto coach to kind of figure out what was going on. She said, it's probably potentiation. Here's what you should talk to your doctor about. And I went to my psychiatrist and I kind of explained what was going on. And he agreed that the best course of action would be to reduce my medication to 80 milligrams. They come in 20 milligram tablets. So that was kind of the easiest taper option. And so I did that and felt a little bit of relief, but I was still experiencing some degree of sedation. And so again, chatted with my psychiatrist and he said, let's try moving down to 60 milligrams. And so I think about a week later, so about 4 weeks in now, I went down to 60 milligrams. And that felt a lot better. I felt relief from the sedation that I was experiencing, but my symptoms were still being properly managed. And this was kind of a wild step for me because I think 60 milligrams is the lowest I have ever been. And that was when I was trying to taper down on my medication to try to reduce my medication or get off medication a while ago, a couple years ago now, without using the ketogenic diet, just kind of on my own. And that experience did not go well. I ended up experiencing psychosis and I ended up hospitalized. And That's maybe something I'll get into a little bit more later in this video, that experience of psychosis sometimes being induced by coming off medications. I'll talk about that a little bit more later on, but I have been on 60, or I was on 60 for a couple months. So the second and the third month of being on the ketogenic diet, and was feeling really, really stable throughout it. I still didn't experience any onset of symptoms or anything like that, and generally was doing really, really well. I've never enjoyed being on psychiatric medication, and I'm not sure there are many people out there who do, per se, enjoy being on it. And so it's always kind of been in the back of my mind, this desire to reduce or go off at some point in a safe way, if it was, if it was safe and I was able to manage without it. And so going through these 2 months, feeling really stable, feeling the most capacity I've ever felt, I think, thank you to the ketogenic diet and focusing on metabolic therapies and whatnot, I decided I was going to talk to my psychiatrist about trying to reduce my medication again, because things were going really well and I wasn't experiencing any symptoms. And yeah, it worked well the last time. And so I think it was last week, let's say about 5 days ago, I had an appointment with my psychiatrist, and I asked him about reducing medication again. And he was very open to it and said, yeah, let's try reducing by another 20 milligrams, go down to 40. And then he actually said, if that feels good and is going well on 40, he gave me the go ahead to, in 8 weeks time, so about 2 months time, reduce again to 20 milligrams. So this reduction in medication that I did about 5 days ago was kind of coming from a different place than the last reduction in medication, which came from the potentiation effect, where I was feeling really sedated and the effects of over-medication. This time around, it was coming more from a place of things are going really well. I feel like maybe I don't need the medication or as much medication anymore, and giving that a go. So kind of coming at it from a different place, and maybe perhaps explaining a bit why this experience is feeling a little bit different this time around. And I'll get into why it's a little bit different and maybe even a little bit harder. Well, yes, harder and more to it, I guess. This time around, I think I am definitely experiencing withdrawal symptoms. And when I think about it, that makes sense. I was taking 60 milligrams of lorazepam and I went down to 40 milligrams, which is a third of the dose. That's quite drastic when you take it relatively speaking. It's only 20 milligrams, but still that was a third of what I was on. And so it makes sense that my brain is kind of freaking out a little bit at the absence of that, especially since I've been on psychiatric medication, antipsychotics, for over 10 years now. So my brain is very, very used to it. And I've been doing a bit of digging more into withdrawal from antipsychotics and what that experience is like. And, it's been validating to read that some of the things that I'm experiencing. So things like what I'm really struggling with, I think, over the last 5 days is I'm experiencing nausea. That's not great. And nausea coupled with this kind of like fogginess or lack of ability to concentrate. And that's kind of been hard and made me feel a little bit detached, and is something that I've been struggling with, and minor headaches and stuff like that. But, I've looked into what withdrawal can entail, and those are all potential symptoms of withdrawal. I think I'm coming into this taper level with, peace that I may need to go up to 60 again if things don't go well, and I'm okay with that if this isn't a good experience and I need to do that. But also a desire to kind of push through this uncomfortable period where my brain is learning how to function without this steady dose of psychiatric medication. And also doing a lot of reflection on how this aspect of psychiatric treatment is not in a good place. I think that, and I don't want this to sound anti-psychiatry or anti-psychiatrist, but many, many psychiatrists are very quick to prescribe these psychiatric medications without ever walking the patient through these potential dangers of being on them, where you get dependent on them. And then when you remove them, you go through a very real and very difficult withdrawal period. And something that I had no idea about, and which could help to explain my previous experiences trying to taper off my medication, or when I just quit cold turkey, is that when you go off antipsychotic medication, it can actually induce psychosis. just because you don't have that medication anymore. So there's an article talking about different experiences of this, and it says when an antipsychotic and thereby the dopamine blockade are removed or reduced, the brain is overwhelmed with dopamine, partly because of the abnormal drug-induced sensitivity and number of dopamine receptor cells. This can result in a withdrawal psychosis, which is often mistaken for a return of the schizophrenia that the drugs were intended to treat. This, in turn, often leads to a reinstatement of the drugs that have, paradoxically, caused the neurotransmitter abnormalities. And this just really rings true with my experience of going down on medication or going off of medication and having this experience of psychotic symptoms again that I thought was the return of my illness, but could very well and very likely just have been my brain kind of freaking out with the removal of the antipsychotic medication that it became dependent on over years. And so those are just kind of some things that I've been reflecting on going through this withdrawal process of tapering off my antipsychotic medications. And yeah, I think that that's an area that needs to have some work or needs to be developed more in terms of informing people who are going to be going on these medications a little bit more of the long-term risks, including experience of withdrawal difficulties such as psychosis or other things. And it's important also for me to communicate that with this reduction to 40 milligrams, I'm still not experiencing symptoms. What I'm experiencing is what I described: the nausea, the lack of ability to concentrate, the headache, and the just kind of feeling a little bit like out of it sort of thing. And while that is extremely unpleasant and not something that I'm particularly enjoying, it's still not symptoms of schizophrenia. I'm not experiencing hallucinations, delusions, paranoid thought. Really, even the negative symptoms aren't really there. I'm not really struggling with mood or anything like that. And so that's kind of the main reason why I'm feeling like I'm wanting to choose to just try to push through this period of discomfort that I'm experiencing of withdrawal symptoms. And hopefully my brain will be able to kind of sort itself out and get back to what feels like normal after, I hope not very much longer, but who knows, perhaps a couple weeks. We'll see. We'll see how long it takes. But if I am continuing to struggle, or if I come into experiencing symptoms or whatever, I will definitely be contacting my psychiatrist to figure out how best to deal with that, whether it's going back up on my medication. I don't know what that might look like, but I will definitely be working closely with him too. But that is kind of a big summary. So I'm currently on 40 milligrams of lurasidone, and hopefully things will sort itself out and I will still be experiencing minimal to no symptoms in 8 weeks' time, at which point, if I'm feeling comfortable with it and if my psychiatrist is still okay with that, trying to reduce down again to 20 milligrams. And it's feeling, I don't know another word to say it other than a little bit wild. Like, I did not anticipate this happening this quickly through this process. I think at the beginning I said that I wasn't even going to touch my medications until 5-6 months in, when I was sure that it was working for me, the ketogenic diet or whatever. But I don't know, it's just been so impactful that this just feels like the right decision. And, working in conjunction with my care team, we've decided that this is the right decision for me. And that's something that's important to communicate, is if you are trying the ketogenic diet and it's not a good decision for you to go down off medication as quickly as I am, that's okay. It's going to be a different experience for each person. And crucial to be doing it in conjunction with your psychiatrist and your care team, and being involved with them in making those decisions about how to safely do it. Psychiatric medications are not something to be messed around with. And I really want to stress this once again, one last time. Please do it in conjunction with your care team, your psychiatrist. They will be able to help guide you how to do it in the safest way possible. Another element too of this, me sharing my experience that may be different for other people, is how effective using the medical keto diet is. It works differently for different people, and we still don't know exactly what the mechanisms are of how it works or why it works for some people or not others. So I just kind of also want to give a bit of a disclaimer that I've been sharing this really successful for me, implementation of using the medical keto diet, and it is allowing me to taper relatively quickly off my psychiatric medication, but that may not be its effect for everyone. It may affect other people differently. And while I totally think that it's worth a shot for anyone, I think you need to come into it with an understanding that it may not be this effective for you. It may be more effective for you, but it may not be this effective for you. And so again, that's kind of why it's also really important to work in conjunction with your care team with medication and with using the medical keto diet so that they can kind of guide you through and help you to figure out what's working for you, what's not, and what best course of action is for you personally. So that's an update on where things are at with my medications. Unfortunately, it is actually spring break this week, so my kids are off school and I'm trying to spend a lot of good quality time with them. It's been a little bit harder because I'm experiencing these withdrawal symptoms and it's felt a little bit hard to bolster the energy. So maybe that was also a bad choice of timing on my part to do a med reduction the week before spring break, but trying to soldier through it. Again, grateful that I'm still not experiencing psychotic symptoms. It's really just the kind of uncomfortable symptoms of nausea and not really being with it. So hopefully those will subside and hopefully I will be feeling back to my normal self again on this reduced dose of medication. But I will continue to share with you as it progresses over the next few weeks, months, however long it takes. So thank you so much for watching, and as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.